Since the 1st of June this year, I've been the Strategic Director of People Services and the Clinical Accountable Officer for the CCG because we've merged in health and social care in St Helens. So in essence, I'm the Director of Children's Services and the Accountable Officer for the CCG. Previous to June, I was the Accountable Officer at the CCG, and prior to that, I was Chief Nurse. So I've been involved with the local safeguarding board in St Helens since 2014 when I was Chief Nurse. And since I've been involved, we've had a couple of serious case reviews where it became evident that harmful sexual behaviour was probably an issue, and yet we felt as a board we probably didn't really have a good understanding of that, and as a borough probably didn't really understand it. So we then invited Pat from the NSPCC to come and do a presentation, and it was very, very good, and the whole board felt quite excited by the presentation and the idea of using the framework, because we recognised we probably had unmet need and we needed to do something, but I don't think the position we were in at that time as a board we could have done that on our own. So we very much felt the framework would be something, a vehicle to help us assess where we were as a borough. I think the key here was the fact that it was an LSCB-led project, but then it was the fact that I led it, and I was at the CCG at the time, but had complete endorsement with the then Director of Children's Social Care. So 2 of your 3 statutory partners were leading the process. Police were with us, and where you may have got resistance, and my understanding is there might be some resistance in other parts of the country, say from health providers, I think the reason we didn't get that in St Helens is because the CCG led the process and we commission health. So in a way, I just kind of mandated that we would expect both the CCG and our health providers to be involved in this process. Now, we didn't do it quite like that. You know, it was through really collaborative working through the board, but I think by the CCG being such a lead partner in it from the beginning, that's been a big key to our success. I think the main thing I would hope would change, I think what the audit told us is probably what we hypothesised before we started it, which was there really wasn't great awareness of HSB in St Helens before we started this process. So as part of our action plan following from the audit, we are doing a lot of awareness raising. So one of the biggest things I would hope would change is that actually out there in the place of St Helens, professionals and others are recognising the signs of harmful sexual behaviour, which means they're recognising risk in our young people, and ultimately that will hopefully safeguard young people more. Where also it will help us recognise the true need on the ground, and if we then need to commission new services to support some of our young people around this agenda, then that's what we'll do. But the biggie for me is a whole subject that is a risk to young people we didn't really understand, and we now know that we've got a gap and we're addressing that gap. And that can only improve outcomes and experiences for young people and keep them safe in St Helens. I think one of the big things that the audit's contributed to is some of our integration plans in St Helens. So one of the things we're trying to get health to do differently going forward, and it's linked to this work, is wrap much more closely around schools. And I know in theory things like school nursing and health visitors are aligned to schools, but what we're trying to do now in St Helens, we've geographically divided the borough into 4 localities, which has all been around, a lot of that has been around adult health and social care, but we're now making that about children's health and schools and social care. So we're clustering our schools into those localities, and we're going to cluster some of our children's health services around that. And I think HSB is one of the areas where we can get our health providers to really support schools in their work with this, and some of the other issues we're working on is around children's low-level anxiety and mental health. So I think this work going forward, we're trying to get schools and health services to be much more closely aligned and working together to support young children and young people. And HSB will be one of the areas that I would expect to see an improvement in. So yeah, I would absolutely say to any other local authority area that the framework for HSB has been a really, really powerful tool for St Helens. It was a framework that we could galvanise all the partners on, and it wasn't just that the framework and filling in the audit, all the supporting materials that came with it, and some of the videos that we've seen through the NSPCC to raise awareness of this area has been really, really useful in St Helens. So I would recommend anybody who hasn't used the framework to at least look at it, to go onto the website, look at the materials and just understand the topic area, but also see how a formal framework that's underpinned by evidence can really pull a partnership together and help you assess your area and where your gaps are.